Hi, I'm Dr. Manjunath Kodihally, Chief Consultant Orthopaedic Surgeon and a Robotic Joint Replacement Surgeon at Fortis Hospital Nagarbhavi. Today, I'm going to talk to you on revision joint replacement surgeries. So, when we are talking about joint replacement, the first question after the patient consent for the surgery, the first question it comes to their mind is how long the joint will last. So we say 20-25 years. So now, then how the revision is coming now, how the revision surgeries are coming now. So as I tell my patients, it is not the joint which is going to fail majority of the times. It is the quality of the bone which is there, how you are going to take care of your joint. That's where the wear and tear of the joint will happen, and that's where the revision joint replacement surgeries come into picture. There are a couple of reasons for revision. One is aseptic loosening. When we implant a joint, majority of the time we implant with a bone cement into the metal. There will be metal, bone cement and the bone contact. So there, if the bone quality is reducing, if the patient bone mineral density reduces, if they become osteoporotic, then you have this aseptic loosening. The second is infection. That's where your diabetic has to be strictly controlled. And then when you are sick and all, you should take care of your infection at the earliest, and you should look for some red flags for the infection around the joint, so that instead of going for the revision, we can rectify at the earliest stage. Third part, wear and tear of the joint, and then fractures. If you tend to have a fall with a fracture with an implant, there we need to revise. And then stiffness. Sometimes in some cases, even after the surgery, the patient will land up with stiffness. They will not be able to get stability and the range of movement, good range of movement. These are the conditions where we need to do revision. So revision joint replacement has got two parts. One is where the infection is there. That is the one there we have to do in a staged procedure. And then in non-infective revision cases, we can do it in a single stage procedure. In infective cases, we need to remove the implant. We need to put a spacer in between the joint, wait for the infection to settle down, look for radiological markers, hematological markers, clinical assessment to assess that infection is reduced. Then we go for revision joint replacement. In a non-infective cases, we treat accordingly. If there is any fracture, if the implant component can be retained along with the original implant, we tend to retain it. If not, we have to remove the implant, the original implant which has been in the primary cases, and then we need to put a revision implants which has got an extension, or if there is any ligament instability, we have that hinge joints which gives more stability. In that way, we can put a better component with a better stability. So the take-home message to avoid revision joint replacements: once you have a joint replacement, have a regular periodic follow-up with your consultant, so that we can assess quickly. We can pick up early, wherein instead of going for the surgery, we can treat without surgeries. And the third part is the complex surgeries, where knee replacement is challenging because it is not the primary OA knee, that's all, but patient is having a congenital deformities, or patient is having a bone which is mal-aligned, mal-united. Majority of the rheumatoid knees where the ligaments are very weak. In these complex redo surgeries, the robotic assisted surgeries will play a major role in placing the implant properly with a finite accuracy. Thank you.